Hi, I'm Beth DeCristofaro, and I have idiopathic pulmonary arterial hypertension. I was diagnosed in October of 2017. I actually was on vacation, looking back, what was a crisis because I didn't have many symptoms before that. In hindsight, I recognize now some of them, but I was functioning, working full time. I was diagnosed after going to an ER, short of breath, barely able to walk, feeling horrible. And the ER doctor said, we've called in a cardiologist because we have no idea what's going on with you. And that weekend I was diagnosed. So within about 4 weeks, I was on an IV and an oral med. I had originally been put on 2 orals, but did not respond well. And so my PH specialist said the IV is the way to go. And I've been on that since and responded very well. So they were right. So I was diagnosed really quickly, and I know that's unusual for this disease. Came out of the blue in many ways. I had noticed about 6 months before that I was having trouble walking up the stairs, but I figured I was out of shape. So I did not even really understand when I was first told what it was. I think I just knew that this was pretty serious. And so what do we do next? And it was later when I got to an excellent PH specialist, cardiologist, that it began to sink in. I had been in pretty severe heart failure. And then it began to hit me like a ton of bricks. What does this mean? Do I, in fact, have a real life-limited type of a diagnosis now? So my family and I kind of began to look at that and say, what do we need to do? What was interesting is, as I was beginning to understand and realize the limitations, I began to also respond quickly to the medicines. So it was always oh my goodness, I'm living every day with my mortality in a way I had never done before. But on the other hand, I knew I was being helped. And so it was sort of this astounding off-balance feeling for a very, very long time. I was put on the IV therapy in end of October, and I think it was probably the end of March, beginning of April, that my own doctor said, hey, would you be interested at all in being part of a clinical trial? And then it was April and May that I got involved in it. And it's been better. I've had a better response for me personally than I ever expected, which is just amazing. My background has been in healthcare for many years, so I was always open to that idea, but didn't really realize you could do that as an active patient. So I am on a trial that is a small phase 1 trial, and it's called ABI-009 for patients with severe pulmonary arterial hypertension. And it is an interesting trial because this drug is already FDA approved. It's an immunosuppressant that's been used for years for transplantation patients. They're looking at what immunosuppressant properties might also be appropriate for PAH. They are finding certain similarities, and this also has to do with inflammation in the arteries. So it's a very small trial. There's no placebo. We all know we're getting this particular drug. I think it's really sped up my positive response. I'm seeing a big difference in my own health. So my overall feeling about clinical trials is that they're absolutely necessary. I had never bothered looking into one very closely. And when I received the information, and they give you copious amounts of information and spend a lot of time explaining the process and answering questions, I did really want to hear what the risks were versus the potential outcomes. I was willing to settle for a neutral outcome for me, quite honest, but I also didn't want to put my own health at risk, mainly thinking of my family and my responsibilities. And in this case, I felt that the risks absolutely were not so overwhelming it was worth doing. And another big factor for me is not only is my own doctor one of the researchers in this trial, but I live close enough that going once a week or even multiple times a week, because that has happened too, was not completely out of possibility for me. And in fact, it was a little bit of reward in that I did have to quit my job due to the pH. And so here I could give back a little bit in a way that I hadn't been able to do since I was no longer working. So it didn't take a lot for me, but I did research it pretty thoroughly to say, absolutely, let's go ahead and let's do this. This particular trial I'm on is 17 weeks long, which counts pre-tests and post-tests. And one of the advantages, in my opinion, is you get to see a doctor every single week. I have had an echo done every 4 weeks and lab works consistently. In order to start, I did have to have a right heart cath, and we'll have one at the end. But that's okay for me if they're showing me what my pressures are doing. Lots of blood sticks, but that's okay. We can handle those. There is a stipend that I get every time I go in, and that helps defray costs, parking and what have you. And I will be finishing up now in 3 weeks. Again, that battery of tests is the very final week. And then I'll be able to also get that wrap-up summary from the researcher who is my own doctor. And so again, I find that to be a real plus for anyone who's able and willing to do clinical trials, is the close monitoring, not only of what's happening positive, but absolutely if there's any side effects or concerns, they ask you about it and monitor those. And anytime you want to back out, you can do that too, but I have not been tempted in the least. If you're thinking about or wondering about clinical trials, I would say start with your own doctor. What does he or she know about it? And help you begin to think about what might be in your best interest, but also what are promising avenues. And then look carefully at the risks, but also look at the benefits. And I personally have had no complaints and feel like it's a chance to do a little something for the people coming after me, because frankly, I'm where I am doing so well because of the people who came before me. As you consider, of course, there is the federal website, but also phaware Global now has a matching tool that you can plug in where you are and what are some specifics. There are questions that you answer about your own pH situation, and trials will come up in your area that you are probably eligible for, and you could even do some research right on there. Does anything look interesting? Anything look promising? And that kind of easy way to get in the process is something you could do today. I'm Beth DeCristofaro, and I'm aware that I'm rare.